Welcome to the February edition of The Pulse. I'm Gary Paxson, and with me this month is Tammy Gavin. Tammy is on our executive team. She's Vice President of Outreach Services. Tammy's been with us for 33 years in a variety of roles. It's a pleasure to have you here today.
Thank you for having me.
My pleasure. We'll start by getting to know, we've had some new employees that may not know who you are. So you've been in the community for a while.
Yes.
You have 2 kids.
I do.
And you have 2 siblings that are mostly local, but one has moved away. So
Yes.
So
I
tell
have a
us about
husband,
your
Peter.
family. Yep. Uh-huh.
And then I have 2 children, Matt, who is a registered nurse and works in the cath lab, and a daughter, Rachel, who lives in El Dorado and teaches school there. I do have 2 brothers. One has moved away,
Yeah.
Dole, and Alan is our local chief of police.
Indeed. So good local roots, which we always love. It helps. It just helps with the team building and spirit of hometown spirit, etc. So it's great to know. So today, when we want to talk about 2 specific things. First of all, you've been working for well over a year in the space of telemedicine. We've talked about how that's an emerging trend in our industry across the country, and we wanted to be part of that. And so we launched a new product in December. So tell us a little bit about that.
The product we've launched is called WaveLink. You can go to www.whiteriverhealthsystem.com and click on the link to WaveLink. And in WaveLink, you're connected with an advanced nurse practitioner who can see you if you're having problems. It never fails. As a mother, that you get home at 5 o'clock and your child was sick, there were no physician offices open.
Sure.
You had to miss work the next day, but through this, you can click on that link, be connected to a provider who will assess the situation and determine if you need medications or need to be seen at a local ER clinic if there needs to be follow-up. We have some excellent nurse practitioners who are waiting to take the calls, and so that helps free up the ER for true emergencies.
Sure.
And helps with the cost of that as well.
Absolutely. So we refer to it kind of like a digital urgent care, which is it's just very convenient. We talk about a lot the advantage. So there's a lot of these companies across the country. Some of them literally are sitting in states across the country. And so when it comes to that differentiation that says, gosh, this is more than we can handle just talking, our competitive advantage is we have multiple handoff routines. So
there's 2 things that really have helped us is that, one, all of our practitioners are documenting in our existing medical records.
Mm-hmm.
And so if you were seen last week for similar symptoms, they can see what the doctor saw when he saw you or the APN and what they treated you with.
Yeah.
This way we can do follow-up with that. Likewise, the next morning, if we've seen you on telemed tonight and you're still having some problems, when you go see your own provider, if they're employed by White River,
Sure.
then they're going to be able to see what we did for you.
Yeah.
And so that continuity of care
Absolutely.
is really critical.
Absolutely, and I think it's a competitive advantage for us. We're proud to be
We
able
agree.
to offer to our community and our employees.
We are. It's our family taking care of our family.
Exactly. Well said. So we're excited to launch that and hope it's used well. And so that's great. The other thing I wanted to take the time to talk to you about is in the last 3 months in particular, did us a huge favor. I asked you to step to the plate and help us in the revenue cycle area. And gosh, we've made some great improvements in the last quarter. As we think about that area, we talk a lot about customer service and patient experience, taking care of our employees, and we can have somebody come, has a great clinical outcome, has a good experience, and then have a really bad billing experience. And there's the side for us to make sure that we collect, what we're due, so to speak, in that arena. But there's also just that experience that our patients have that's so critical. And so maybe share a little bit about what you've seen, what you've done, and where you see us going.
I think the major thing that we've identified over the last quarter is that we've had a lot of consultants in the last couple of years.
Mm-hmm.
And that sometimes causes disruption.
Mm-hmm.
And
Indeed.
so going back to we want our family taking care of your family, we now have people in that department who are from the surrounding area live here in Batesville, work in the surrounding area. And we've identified Lisa Lambert as a leader,
Yes.
as our Executive Director of Revenue Cycle. Lisa's been here 31 years, and so she understands that billing process. She understands the impact that a negative billing experience can have.
Yeah.
We've identified some billing errors that were occurring, not so much, never intentional, but things that would hook up in a computer system and cause a delay.
Yep.
One of the things we do is, because of the sheer volume, we outsource billing, the statement
Yes.
printing, we outsource, and then follow up if your insurance is paid and it's a self-pay patient, then some follow up. And one of the things we've heard loud and clear from the community is that they're getting phone calls about what they owe before they get a statement.
Yeah.
And so we have in the last quarter put in some vendor management, identified goals and objectives for them.
Fantastic.
We've terminated a couple of vendors that weren't meeting our expectations. So we are really working to bring as much of that in-house as we can and correct as many of those issues as we can.
Wonderful.
And it makes for a good experience for the patient.
Yeah, absolutely. And I think internally we've seen a dramatic improvement in the spirit of those that work in that area, which is important. It's
Yes, it
very,
is.
very meaningful work, and we appreciate everything they're doing, and certainly appreciate you stepping to the plate and helping us move
Thank you.
forward.
I'm proud of that team. They've done a good
Absolutely.
job.
They have. They've done a great job. So, Tammy, thanks for coming to visit with us
Thanks
today.
for
It's been
having
a
me.
pleasure. You bet. We have two great employees of the month for you to share this month from Stone County. Scott Wood from the radiology department was recognized for just being very helpful for coworkers and patients. Scott's been with us for just over a year. Scott, congratulations. Thanks for your great service to our employees and to our patients. Then at White River Medical Center, Mary Bishop is an RN in the maternity ward, and she's been noted for prompt response and prompt service. We appreciate, Mary, all of your service. You've been here with us for 19 years. That's a great tenure. We thank you for your service, and we congratulate you on being nominated for this fantastic award. In the area of news, February is National Heart Month and National Wear Red Day. In support of that is on February 7th, and so we're encouraging you all to wear your red and then take pictures of those and get them sent to Bailey Williams in the marketing department, and we'll get those out on social media just to share the spirit. And we'll actually have a photo booth set up from 11 to 1 for employees to use and take those pictures, and just come on out and help us celebrate an important event for all of us personally, and certainly for those that we serve in our mission for healthcare as well. So during Heart Month, the month of February, we're promoting happy and healthy hearts, and we also want you to send your name, your department, and some other information on what inspires you to be heart healthy to screenings@wrmc.com. And for our employees, we're going to do a drawing for some prizes for that, and see just inspire us all on what inspires us to keep ourselves healthy and motivated in that arena. On February 11th, we have a free community health event. Dr. Block will be with us, and she's going to be talking about hepatitis C. It's a disease that's in our society, but very, very curable. And Dr. Block's done a great job at treating that disease, has some expertise in that arena, and so we encourage everyone to come out and hear her talk about that and great treatment options to alleviate that disease as well. The month of February, we'll also be doing employee forums. So between February 11th and February 15th, we have multiple opportunities for our employees to come out and visit and let us talk to you about what's going on in the health system. We encourage you to attend, sign up for that, and come on out, hear some news, and we'll have drawings like we did last time for encouragement as well. And so we hope to see you there. Hope you have a great February. We will see you all soon at these great events.